While scientists and experts are still working to find answers to many unanswered questions surrounding this new Omicron variant, some doctors in South Africa who have treated cases said the symptoms appear to differ from what many have come to expect with the Delta variant.
Yeah, 22 News reporter Katrina Kincaid is live in Springfield this morning to explain the difference.
COVID symptoms with the Omicron variant, scientists in South Africa are describing as extremely mild. They're the ones who first reported the strain to public health officials. Now, they do say that older people, though, infected by the new variant could have more severe symptoms. Symptoms doctors in South Africa found are flu-like symptoms such as dry coughs, fever, night sweats, and a lot of body pains, but also unusual symptoms that differed slightly to those associated with the Delta variant, such as extreme fatigue, body aches, a scratchy but not sore throat, and no loss of taste or smell. Symptoms of the Delta COVID variant, that's the main variant in the U.S. right now, are found to cause more cold-like symptoms such as headaches, runny nose, sore throats, and the overlapping fever symptom. Now, early evidence on Omicron shows that there is an increased risk of reinfection compared to other highly transmissible variants. That means that people who have contracted COVID-19 and recovered could be more likely to get it again. Working for you in Springfield, Katrina Kincaid, 22 News.
Now, of course, we expect to learn a lot more about Omicron over the coming weeks. But what we know now is that it has more than 30 mutations on the spike protein alone, so a lot of mutations. And these distinctive mutations actually allow us to identify the variant when a lab sample is then genomically sequenced. The variant, as you know, has now been identified in California. If and when it arrives in Ohio, rest assured, we'll be looking for it. So we don't know yet if Omicron will be more contagious, cause more severe or less severe illness, or be more deadly. But let's remember that there were other variants of concern, ones like Beta and Mu, which spread rapidly in other parts of the world, but actually never took hold here. Now with Omicron, as in the past with new variants, it is time that will tell the story, and we will be watching very closely. Importantly, at this time, we have no indication that our vaccines will fail to provide substantial protection against even Omicron. Especially, we're reassured that it does appear to, our vaccines do appear to protect against severe disease. In fact, Dr. Angelique Coetzee, who chairs the South African Medical Association, has shared that South Africa's hospitals were not overwhelmed by patients infected with the new variant, and that most of those hospitalized with Omicron, in fact, were the people who weren't fully immunized. This means that as we anticipate the potential emergence of Omicron right here in Ohio, there's a very important step that you can take to protect yourself and your community, and that's to get vaccinated. Don't delay your COVID-19 vaccine. If you haven't yet chosen to be vaccinated, go get your first booster today, your first dose today. Obviously, if you're eligible for a booster, get that today.
Many health experts are concerned because this variant appears to be highly transmissible. They've seen this moving in other parts of the world. However, there is reason for some cautious optimism.
KCRA3's Melanie Wingo explains why some doctors think this variant may not lead to as many deaths as the Delta variant.
Over the past week, we've heard a lot about Omicron, the latest in a string of COVID variants, of concern to health experts, but they say there's a glimmer of optimism they have about Omicron.
As of yet, we have not seen it behaving badly, at least compared to the Delta variant.
Dr. Mark Vaughn of Auburn Medical Group says as of right now, there are no reported deaths of people known to have been infected with the Omicron variant.
We're actually really concerned, I guess, distracted by the possibility of it being a more deadly variant, and never really thought in terms of, well, it could go just as easily the other way.
That other way being people end up with more mild symptoms if they get an Omicron case of COVID versus one that results from the Delta variant.
And if you think about it, any living organism or virus, if you don't consider them to be living, The way that it exists in the future is by spreading and multiplying. So there's more copies of it out there.
Getting more copies out there could be as efficiently done by the virus as going easier on people with it.
So it may be, in that sense, a better virus in that it is more likely to spread because it doesn't kill its host right away.
With Omicron in the mix, the White House talked vaccination efforts this week, touting Wednesday's highest single-day total of vaccines administered since May. 2.2 million shots in the arms of Americans.
And then Omicron, of course, is the latest thing in the picture that motivates people.
Dr. Vaughn says people seeking boosters or protection at holiday gatherings and newly eligible kids are contributing to the number of the vaccinated. Although it's too early to know just how effective vaccines are against Omicron, Dr. Vaughn says early data is promising.
We know that there have been people who are fully vaccinated who are showing up with Omicron, thankfully, just like all the people with Omicron, with mild symptoms.
Melanie Wingo, KCRA 3 News.
Dr. Vaughn says he expects that we'll see COVID case numbers go up after the holidays because Omicron may spread more easily. What he and the other health experts will be keeping a close eye on is how many of those cases result in hospitalizations or death.